Okay, thank you so much. Yeah, tough, tough morning. Um, thanks. I appreciate everyone being here, but it's a tough morning. And that's why we are a little bit late. But I just got word that a very good friend of mine, who many of you actually know, but I'm not going to make that public right now. That he just passed away from COVID this morning. And, I think it's really, it's hitting home for so many of us. And I'm pleading with you to take this seriously. I mean, this just shouldn't be the way that it is. And, every week now I'm having friends call me and tell me that they have it. And some, I got to tell you, are walking around thinking that they have a cold. Some people obviously are doing better with it than others. And then some are not so lucky. And I don't want to hear this anymore. Well, the death rate is so low. Because if it's your family or your friend or your loved one, it matters. I just never thought I would be that person that got that call. So I apologize, but literally I just got that call about, I don't know, 10 minutes ago. And it's so bothersome because people don't have to die from this. If we all just do what we can, I think people need to understand these next few weeks are going to be tough. They're going to be very difficult. And I know tomorrow, actually, we are going to hear from Dr. Knight. She is our medical examiner. She is a wonderful woman. But it's bad in a community when you are going to hear from your medical examiner. And that's why I'm asking people to please take this seriously. I know, people have called me a communist. They've, called me a liar. They've called me a hoax, and I don't care anymore. And you need to hear it. And I'm just going to ask you, please, I will, everything in my power, just asking you, please do not gather in large gatherings for Thanksgiving. If you truly love your family and friends, you will not do that this year so that you can have many more years to come. So I'm begging you. I am. Anyway, we also have Dr. Jeremy Smith and Councilwoman Naomi Dewar and Dr. Eric Nielsen. He is an ER physician treating COVID on the front lines. I wanted to bring on Councilwoman Dewar and Dr. Jeremy Smith to talk about the COVID meter, to show you what we are seeing. And many of you know we are treating people in a parking garage at Renown. This is serious. And our numbers are certainly reflecting that. And Jeremy can talk more about the COVID meter and the data that we are seeing, because it is very real. So Dr. Smith, go ahead, the floor is yours.
Thank you, Mayor Sheevy. I'd like to actually hand it over to Councilwoman Naomi Dewar to start us off.
Okay, thanks, Jeremy. First, Mayor, my sympathies to you. It's very difficult to go onto a press conference in this situation. I've had to do it a couple times myself. One of my very closest friends has already lost 2 of his brothers to COVID. So it's nothing to fool around with. It's real. My mother died in February, right at the front edge of this, and they didn't have the COVID test, but she was on a ventilator. It's pretty clear there was probably a complication there. I think it's important today that everyone on the call take away some key messages. And those are that the case counts and the hospitalizations are continuing to rise. We heard some staggering numbers from Dr. Slonim, who is the CEO for Renown Hospital yesterday, over 100% capacity. That's why they're in the garage. The other thing is that we all need to remain diligent in following our safe practices that we've been preaching for so long. And I'm a case in point. I have made it a point for the past 40 years to fly out of state, meet up with my family for Thanksgiving. I would have left last Friday. And I called my brothers and I said, what are we doing? And they said, we're socially distancing. none of my three brothers and their families were coming together. And I said, good news. So we canceled everything. I'm just having dinner with my husband and that is it. On the terms of the COVID meter, we have transitioned to a weekly score that's more understandable to get across the message. We're still calculating a daily score, but we really think it's more appropriate to focus on how the overall gauge changes. We've been very close to going into the purple last week. Half a point, 1 point, we would have been there. Some people say we should be there. We're not going to make the meter do something. We've built it based on data. We want to stick to it. But if hospitalizations get even a tiny bit worse, we will be in the purple. We only put purple in there as a last ditch to think, well, here's something we'll never reach. You know, any kind of meter should always have some number above which you're going to reach. And that's how we looked at purple. And the fact that we're that close is really concerning. Finally, we've received questions, feedback on the meter about things like, well, how can the daily score go down a little bit and still be in the red? And does that mean anything? And that's the point at which I want to hand this over to Jeremy to really dig into the details so you can understand that the daily score may change, but the weekly score is where you need to focus. We are firmly in the high red, and that has not changed for weeks. And in fact, we've tapped out on all of our indicators on case counts, on assessments. They're as high as they can go. The only thing left to go a tiny bit higher is hospitalizations. So with that, I'll hand it over to Jeremy and he can explain in a little more detail.
Thank you, Councilman Dewar. That's absolutely correct. And I have a couple of slides I'd like to share, if I could please here. Start that. Okay, you guys seeing my screen right now?
Yes.
Okay, thank you. So, this is really the focus of what we've been trying to do is create messaging around what are the conditions around COVID in our region and for a given period of time. In this case, we've moved to a week, as Councilman Dewar mentioned. We are in the very high. So you can see we're just one tick away from hitting that purple, that severe, which we really don't want to get to. It's been in this high red state since about Halloween, when we moved up into that setting, kind of did a little back and forth, and that led us to think, hey, maybe we need to do more of a weekly thing. But we've been in that high setting for that long, and since about November 6th, we've been at the second tick mark. So in fact, we've been pushing up against the edge of purple for that time. And so what we want to do is think first about what does that mean? And so really each setting on our meter has an associated list of guidelines, recommended guidelines to help, kind of contextualize where we are in terms of the pandemic conditions in our region and what kind of actions we all can take, what kind of behaviors can we modify about our personal life that will help to keep this thing from going to that purple setting. And so what the recommendations claim for or say for very high, and I'll show you this case number stuff. Everything is high. Hospital beds are filling up. Case numbers are going up. The demand for testing is going up. And so really it's time to only leave your home for essential functions like going to get groceries or medicine, to see your doctor, or to go to your job. You need to be wearing the masks all the time. I mean, I'm at my house right now, so I'm not wearing one, but you can be sure when I go out, I sure do. Stay away from at-risk people and, not really inviting anyone to your home who doesn't live with you. That obviously is really difficult. We're going into Thanksgiving, but that's the choice that we're asking folks to make, is to try to be safe and to not have a big gathering for Thanksgiving, because that's how COVID spreads, from people to people getting together, and basically just socially isolate as much as possible. So those are the guidelines that any given week, when you check in on this meter, or any day you go to look at it, these will be there so you can take a look at that. As Councilwoman Dewar mentioned, every day we calculate a score based on a daily feed of data from these 5 indicators we have. And you can see them on the left there. We have risk assessments. That's folks filling out a form to get a free test for COVID at the Walsh County Health District. That has been going up just almost exponentially. It used to be that they would get a couple hundred, maybe 300, 400 was a really big day. Now we're seeing days almost 1,000 people calling in and online to try to get a test. So that's gone up incredibly. Test positivity continues to rise day over day. We're approaching 20%. Our maximum threshold in our model is 12%. So we've blown past that now in terms of test positivity. Daily new cases, I want to back out and show you one other graphic here to kind of describe that. Everyone can go get this at the Washoe County COVID dashboard. Are you still seeing a graph? Are you seeing the purple graph? So back in July, around the 4th of July, we had a spike that took our risk meter into the red. Well, that compared to what we're seeing here in terms of case proliferation through October and November, that didn't even register. So back in that period, we were at around 1,200, maybe, just over 1,000 active cases. As of the most recent data, we're almost at 8,000 active cases. So there's been an exponential increase in the number of cases in our community. And so that is maxed out in our meter, as Councilwoman Dewar mentioned. We'll go back to the big slide here. And so you can see that all three of those are generating threes in our model. And really where we're seeing now that we have just a tiny bit of wiggle room before we get into this purple setting is with our hospitals. And so if medical intervention, so if people have to be hospitalized or go to an ICU bed, if that continues to increase, because the hospitalizations have been going up over the past 3 weeks, that could push us in there. Likewise, if we've turned on the parking garage, and so something we're currently in research around just exactly what's going on with hospital capacity, and it's possible that this number might even be a little bit higher than 1.5 in terms of the capacity we have. So really urging our decision making, our personal behavior can help to keep this meter out of the purple and to help to keep our hospitals have that capacity to treat us when we need it. Last thing is that you can go and see every day the daily score, so you can see it for the day. We have a new bar down here on the COVID risk meter website, so you can see that, and you can also access this graph on the website, which shows you how the model's been performing. And I think what you can see is that over the past several weeks, we've been squarely inside this upper band of red. And based on what I'm seeing with the data, I don't think we're going to get out of that upper band of red for any time soon. So with that, I'll pass it back to you, Mayor Sheedy. Thank you.
All right. Thank you so much, Jeremy. Really appreciate it. But we're so close to that purple. It's just absolutely alarming. It really, really is. So with that, I want to hand it over to Dr. Nielsen. He has been an incredible committee member and an advisor to all of us. And Dr. Nielsen, one of the things I want to ask you, I guess I'm just so incredibly anxious with Thanksgiving coming and seeing where the meter is now. Do you think that we will hit the purple level because of Thanksgiving? Oh, I think you're on mute. Oh,
How about now? Sorry.
perfect.
Yeah, I think we're in for a rough stretch over the next couple weeks. I think a lot of people locally and around the country are still going to proceed with their normal plans. They may be altered somewhat regarding size, but it's still going to be potentially thousands of kind of small super spreader events all around the county as people get together. So we know from data, just being indoors, especially indoors with people from other households without masks, and for a prolonged period of time, there's going to be disease transmission. So, I expect us likely to go to purple in a couple weeks. I think we need to, really understand that our hospitals in Northern Nevada do have limited capacity. There's only so much we can handle at any given moment. We struggle with surge capacity just because our population has grown so quickly. And obviously we know that Northern Nevada and UHS are in the process of building a new hospital right now. And the reality is we probably needed a whole other new hospital a year or two ago. So we only have so much capacity, and the hospitals are working on, contingency plans, especially the alternative care site. There's plans to try to aggressively discharge patients that need nominal oxygen therapy so they can convalesce at home, which would really free up hospital space. But all that takes, organization, money, and a lot of coordination.
Mm-hmm. Tell us a little bit what you're seeing now in the emergency room. Give us an idea for those for those people that might not take this seriously.
We had honestly been doing so well throughout the summer and early fall that we really settled into a pretty good flow in the ER. On a typical day, we might admit 1 or 2 COVID patients, like me personally. And like Dr. Sloan mentioned, we had a census, at least at Renown, of around 40 to 50 that was pretty stable for several months. But just in the last couple of weeks, the hospitalizations are really going through the roof. And I just want to make it clear to people, the patients that we're hospitalizing are pretty sick. They all need supplemental oxygen. And we're, cautiously discharging other patients home that, look pretty sick. We advise them to come back and get rechecked if they feel like they're clinically deteriorating. But make no mistake, we're only hospitalizing the sickest people that truly need in-hospital care. So and the numbers are really just starting to skyrocket. And just the numbers, the active case counts are going up. And we know we just had 2 days of over 800 new cases, and we can reliably expect, maybe 5% of those may require hospitalization 7 to 10 days from now. So, and this is before Thanksgiving. So we're preparing.
And
Dr.
then,
Nielsen? Excuse me, I didn't mean
hold
to
on.
interrupt there.
Let me just ask him this, because I think this is a really important point that people forget about, is that if the hospitals are full, then people that are experiencing heart attacks or car accidents or things like that, then that makes it another challenge, and you might not get the health care that you would expect. Am I correct?
Yeah, we're already having to change, staffing ratios, as far as a nurse to X number of patients during typical times, we've had to alter that. And, as we get more ambulance traffic and sicker people coming in, it can be more challenging to just manage the day-to-day emergencies. We're a pretty big, at least at Renown, we're a big urban busy ER just on an average day.
Mm-hmm.
So when you fold in to that, the strain on the system, potentially 30, 40 patients that require admission a day for COVID, and that could even go up even higher, the system gets strained, and we may have trouble taking care of just the routine emergencies. I think we're doing a good job so far. The staff has been, really stepping up. Our testing access has improved, and we're still able to keep elective surgeries going, and we do have bed capacity. But going into this next couple of weeks, the system may be strained, and we hope
Mm-hmm.
it won't be. But we have to prepare that it might.
Mm-hmm. All right, Councilwoman Dewar.
Yeah, I was just going to ask Dr. Nielsen a couple questions. I know you've mentioned in the past that there are actually ambulances waiting to offload their patients at times. I was wondering if you could speak to that. And also you had mentioned that you had gone from admitting, I think, something like 2 or 3 to 7 or 8 per your shift. And I think you said there were over 20 shifts, or if you could just explain that.
Yeah, so the ambulance traffic is increasing. We're seeing more COVID, and it's just the usual cough and cold season. And once, the local hospitals all start filling up, they have to go on divert. We've had some days where we've gone on divert, and the hospitals have to kind of share the burden of the ambulance traffic. But there's days where, there'll be ambulances lined up to offload their patients, 4 to 5 out in front of the charge desk, just trying to get patients placed to a bed so we can even assess them. So it's been quite busy. And like I said, we've been doing okay so far, but the concern is that it could get worse in the next couple of weeks.
And then how are you treating them? Has that changed over time? You've talked about different kind of interventions you've been using.
Yeah, well, early on in the crisis, especially in New York City, they thought that early ventilation, or putting people, intubating them, putting them on a ventilator, was the best technique. And over several hard months, we've learned that that's probably not the best technique, because the mortality rates are quite high for patients that are on a ventilator. It's up to 80% in some studies. So we try everything we can to avoid that last step. So we're admitting folks on really high oxygen requirements. And it's not just the typical oxygen tubing you see around people's noses. These are more robust oxygen delivery apparatus that deliver much higher concentrations and flow rates of oxygen to support these people, so we don't have to intubate them. If we do end up putting them on a ventilator, that's a really big burden on the system, because the ability to get folks off of the ventilator is challenging. And we know that someone on a ventilator uses a significantly higher number of resources regarding nurses, medications, respiratory techs, physicians, et cetera.
And then it sounded like finally that some of these units, I'm not sure what you call these oxygen delivery systems, were getting a little bit in short supply. I mean, that might be the best treatment, but do we have enough of those?
I can't speak to that. I know Dr. Slonim did mention that last night, that they're in the process of trying to increase some of these kind of ancillary oxygen delivery methods. But we're not the only ones doing that. I mean, everywhere else in the country is doing that. And just like there was a big, draw for ventilators back in March and April, especially in New York, there's probably a national run on some of these other techniques and the equipment, especially. And they may not be, available just because supplies run short.
All right. I'm going to send it back to you, John.
Okay.
Is there,
Do we have any other members of the panel who wanted to speak before we open it up to the media?
no, I think we just have us three.
Yeah, I'll just add something to that. I just want to caution again, I think it's worth repeating that the risk meter is informative, it's educational, but it's not the thing on which people base openings, closings. The school district is being informed by it, but they are having their own meeting today to look at all kinds of data available. And we've already heard from our superintendent, Kristen McNeil, that she's going to be making some recommendations to the school board to consider. But the COVID meter is one of those data points, but I think there are a number of others. The same goes with any other kind of public institution or entity. The governor has given us guidance on those things based on sort of statewide data, but kind of honing in on Washoe County as well. So I just wanted to clarify that it's not an enforcement tool. It's really designed to help people modify their own behavior. Thanks.
Yeah.
All right.
One thing I do want to bring up that I think would be interesting for some of the journalists on here, and Jeremy, you might have the app or the site that we had Dr. Weitz from Georgia Tech join us last night, and he showed us an app that he's actually done modeling for across the country. And what's pretty fascinating about that, they know your risk based on a gathering in groups of people. And so you can click on a certain area. Obviously we're looking at Washoe County, but you can say, in a group of 50 people or more, the percentage of someone having COVID in that group is very high, right? So, and you can sort of modify it, but it's a pretty fascinating tool, and it's been interesting to actually work with professors and doctors from around the country that are doing other COVID modeling, because we think there's other factors that we can put into our local COVID modeling that might be able to help, like predictive modeling for the future. So.
Yeah, would you like, I pulled that website up if you want me to show it really quick.
Yeah, just so that they have it, so they could look at
Sure.
it. I think it's important to message so people understand the risks associated when you gather in these large groups, right? So this is a COVID-19 event risk assessment planning tool. And you can literally hone in on this tool and it will show you. Can you pull up our data? Do you have that in real time or no?
Well, I have got, we can zoom in on Washoe, and I set the size of the gathering to 20 people. And it's reporting that according to their model, even in a gathering in Washoe County, the size of 20 people, there's a 62% chance that someone at that gathering has COVID-19. They don't talk about the potential to spread it, because that kind of depends on the particulars of any given interaction. But based on an understanding of case proliferation in our county, they basically are saying that even with a gathering as small as 20 people, there's a high chance that someone at that gathering will have COVID. And if you change the slider here, you can go to a gathering of say 500 people. It does zoom back out, but I think you can see instantly that, you know, the whole country becomes this dark red color. And if you go in on Washoe, you know, at a size of 500, there's greater than 99% chance that someone there has COVID. And so it doesn't necessarily speak to the transmission, although you would think in a situation like this that transmission would be, you know, fairly effective. But what the Dr. White's point from the meeting when he came in last night was, it really it speaks to how dangerous the potential for small gatherings really can be. Folks might think, oh, big gatherings, that's a place I want to avoid. But even the small gatherings have a significant risk of encountering someone that has COVID.
So how about like 10? I mean, we've been recommended to have less than 10 for,
Yes,
say,
10.
Thanksgiving.
And going in on that, 38%. So that's the lowest setting that this thing has, and it's updated daily. We're going to put a link to this on the resources page of the COVID Risk Meter site, and we're going to talk with Dr. Weitz about how potentially this information can maybe be incorporated into our risk meter, or at least help inform the conversation.
Okay, good stuff. I think we can open it up to some of the media questions. We can start with Cynthia and Channel 2. All right, having some trouble there with Cynthia. Feel free to put your questions in the chat if you need. We'll go to Miles next, or anyone from Channel 4.
Perfect. My question is for Mayor Hillary Sheevy. Mayor, the governor announcing this Nevada pause for the next 3 weeks. He said in his statement that local municipalities, such as local government, can abridge these rules or make these rules different or put severities on these rules. Have you spoken with the governor about this? And obviously with the meter being one tick away from severe, is there anything that you may change within the city limits or anything to help slow the spread?
Well, once he puts something in place, it kind of takes, you know, a few days to kind of look and assess and see kind of what's working and what isn't working. I'm sure many of you know that I feel very strongly about, you know, taking every precaution about mask wearing. We will be following, you know, a mask mandate in the city of Reno. I don't know what other cities are going to do, obviously, in the state. However, I take it incredibly serious. And so, you know, we'll assess to see how the community is doing now with these, you know, new rules. And then we'll go from there. I mean, I think for the majority, we have done well with masking for the majority, but I still see people not wearing them or, you know, not taking it seriously. And as you know, now people are, you know, many physicians are requesting that you keep a mask on inside, even at Thanksgiving when you're around others, where I think, you know, people let their guard down because you know someone, so you think it's safe. And those can be environments where, you know, literally you can get caught. And so, you know, just every precaution that we can possibly take, but, you know, it kind of takes a few days to see what's working, what's not working. Are people following it? If they're not, then we'll do whatever we can. I mean, I think we have to take this seriously. And again, you can call me what you want, but you know, this is very, very real. And I just don't think that we have to lose any more people to this. We just don't have to. That's the crazy part to this. We just don't have to if people would modify their behavior. And all I'm asking for is, you know, a few weeks, because I do think these are going to be some of our darkest days. But I also think too, let me just reiterate this, that there is hope out there. We know the vaccine is coming. So I want everyone to also have a lot of hope, because I certainly do. And I know, you know, many of us on this Zoom call have hope. And we've talked about that this won't be forever. So I need everyone to know that, you know, help us get through the finish line, because we need you now more than ever. But we also have hope. And I believe that, you know, we'll get through this, but it's going to be tough.
All right, good stuff. We'll go to Channel 8. We know we had Stanton on there, but if there's anyone else with Colo, by all means. All right, we'll move on. We've got Scott with AP. Scott, do you have anything? All right, we'll move on to Kristen. Got some quiet folks today, don't we? We'll go now to Saban.
That's good. That means we're doing our job.
There we go.
You're telling everyone. I could ask questions all day long, even though Kristen's taking the lead on this one. Anything else, Dr. Nielsen, that I know mask wearing, staying at home, I'm hearing a lot just from friends who are nurses like, hey, we're treating people with vitamin D and C and take zinc. Is there anything else that could be done? Just, of course, everyone's staying at home and wearing their masks. Was there anything else you're doing or that you would recommend people do besides being physically fit and, things like that? Is there any other thing people could be doing at home? I think people are just looking for some way to do something else.
Yeah, it's a great question. I can't really speak to any of the supplements. Just like any, time we're going into a cough or cold season or a bad flu year, simple things like make sure you get your flu shot, make sure, you're trying to stay mentally healthy. There's been significant substance abuse issues for a lot of people over the past several months. And just doing the general things that just keep you healthy such that if you do get sick, you're kind of going into it with a generally better state of health. But other than that, I don't have any specific recommendations.
You said people are going into the hospital sicker than before. What's sicker? What oxygen levels are you seeing? What's really sick that are coming into the hospital?
It's not so much that people are coming in critically ill, but we're seeing, patients that are, 40 and 50 years old with, not necessarily any significant underlying medical conditions that have oxygen levels of say 85%, which is low. And their chest x-ray looks actually quite bad. It's a phenomenon we call COVID lung, where you talk to the respiratory techs and the radiologists and the techs that do the x-rays, you walk by and one chest x-ray after another just looks the same every day. And so those are the people that are getting admitted. Most of them will probably do okay after a couple of days in the hospital, but some will deteriorate and end up needing a lot more aggressive care, such as going into the ICU, hopefully not getting put on a ventilator, but that's happening. It's more just the volume of patients I think that we're seeing on a more regular basis, which is alarming for the front line.
Okay, good stuff. We'll move on to Sudihi.
Hi, thanks. So my question is about the hospitalizations. So the disease trend is showing an upward movement. And if that continues and the hospitals, the capacities are exhausted, what are the plans from administrative point of view to accommodate new patients?
Is that one for me?
I think that's fun for you, Dr. Nielsen.
Yeah, there's plans in effect. I can only speak to Renown, and I'm not part of their administrative team, but I just know what's going on because from being at work every day. We do have plans to try to, like I said, discharge people home on oxygen, which will free up beds, and do some telemedicine observation of them at home. That'll help out quite a bit. They are hoping to get some extra staff online, but which has been mentioned, I think, all around the country. It's not a phenomenon here that there's significant staffing shortages just because everybody's going through a little COVID surge all around the country right now. And, the healthcare workers are in short supply. So I know the hospital administrators are scrambling to get good travel nurses to be able to help. So it's, I mean, I think the hospitals are really doing a good job in trying to think 2 or 3 steps ahead to say, if we're really bad 2 to 3 weeks from now, how are we going to manage the situation? I think Dr. Slonim specifically mentioned some of that during the mayor's task force meeting last night, that they're working on several different ways to manage an even bigger surge than what we're seeing right now.
Yeah, so what I'm trying to really understand is there any conversation going on with the administration? And I think my question is directed to Dr. Nielsen and Mayor Shivi as well, because I know that Health District was making an appeal to people, especially health workers, if they can volunteer, they should. So I'm just wondering if there is any kind of conversation going on between the hospitals as well as the administration as to how to deal with the situation should there be a further COVID surge.
So I'll just jump in a minute, and Dr. Nielsen, then you can jump in after me. So there have been conversations with Dr. Slonim and myself and our city manager that we on the city side would be obviously willing to open the convention center and put more infrastructure and beds in there to accommodate. And so we're watching that very closely. And we believe that we can do that within 3 to 5 days if need be. Let's hope and pray that that is not the case. And from what I understand, because I speak to the hospitals regularly, is that, you know, right now beds are not the problem. The problem is the staffing levels, right? And so I'm sure many of you know that there has been a plea to our medical community that if we can get people to volunteer their time, you know, that's what we're looking for right now. Because, and I think people forget too, you know, our medical community is just as vulnerable. Some of them are getting sick. And obviously that takes them out for a while. And I don't know, Dr. Nielsen, maybe you could talk a little bit about that protocol. If you should get sick, I would imagine that you've got to be out for 14 days, or how does that work? Do you test and then come back, or what does that look like?
We have a protocol for our group, Northern Nevada Emergency Physicians, that follows the CDC guidelines, but correct, you could be out for potentially 10 to 14 days, depending on your exposure and if you test positive. And so, you know, right now we've got, you know, some physicians out, not necessarily in my group, but hospital employed physicians that my understanding is they're not terribly sick, but they have mild symptoms and they tested positive and they just simply can't go to work. And so that's causing some strain on the system as well. And I can't speak to, you know, the nursing staff necessarily, but I've known several nurses I work with on a daily basis that have had to miss some of their shifts because they tested positive. You know, so I mean that's a reality, because the healthcare workers, especially down in the hospital and the ones seeing the COVID patients on a regular basis, I mean, we're exposed on a significant way. I mean, luckily, due to masks and gloves and gowns and just standard precautions, we haven't had a significant outbreak in our hospital worker population. But with that being said, it's starting to happen. Some of these folks, for all we know, probably got it from community spread and didn't get it as an occupational hazard, because so much of the spread right now is happening inside the home.
Did that answer your question? I think that's what you were referring to.
Yes, yeah, absolutely. Okay. Thank you.
Okay, awesome. We'll go to Noah.
I don't have any questions, John. You're good.
Oh, there we go. Lucia, you are in here as well, so go ahead.
Yeah, this is for our elected officials. With the CISLAC's new restrictions in place, the 25% capacity, I know a lot of businesses are saying that they can't stay afloat with that new capacity. I guess, what are your thoughts on that, and what do you have to say to that?
You know, what I'd really say is that I hope that this sends a message to our entire community that our businesses are holding on by a thread. And by modifying your behavior, you can also help them stay in business. And that's one of the reasons why we had to go down to the capacity, because obviously, people are not following strict protocols. And it speaks to that. Obviously, going down to 25% tells you that we are not doing that great of a job. I mean, and unfortunately, it's the entire country. It's not just Reno, Nevada, but it hits us at the hardest core. Remember, our small business owners are the largest job creators in the country. So you can imagine for those businesses how hard it is to hang on. So again, another plea to modify your behavior, because our local economy depends on you. We're hoping to get more assistance. It was interesting. I was on a phone call yesterday with the Conference of Mayors with President-elect Biden and Vice President-elect Harris. And it was pretty fascinating to hear. Obviously, it's going to take them 60 days to get in place, but it was fascinating to hear how they really said we want to be in unison with cities, and we want to make sure that mayors can come through the front door and not the back door of the White House if you should need anything. But they're going to really focus on helping cities get aid. And that was abundantly clear yesterday, and especially for small businesses, because they know that they are some of the hardest hit. So, that was nice to hear that, people are, thinking about cities at the local level, because I think that's really important. But if there's anything I could stress right now, people do their part by modifying your behavior, because you're also saving a business when you do that.
If you could comment how are businesses doing right now? You said they're hanging on by a thread. How severe is that here in Reno?
I would say it depends on the business. Some businesses are doing outstanding. Like if you're a grocery store, obviously, they have not really struggled, right? Especially if you offer essential items. It's those other businesses like your bars and your restaurants where we're seeing that sector really struggle. Just depends on what your business model is. We've been lucky at the city of Reno. We've been giving out business grants, but that all runs out. And if some of those businesses, if they didn't get PPP, everyone's got sort of a different situation. Some people have tried to leave on their staff, which depleted their financial ability to keep people on. We're just seeing kind of different ways that different business owners are sort of handling and navigating this really challenging system and time. And so as the city, we're trying to do everything we can to possibly get them more assistance. But it's tough. But it also, again, depends on the sector of business that you're in.
Thank you.
And I'll add just that, just to reinforce the mayor's point, what we do at home deeply affects our economy. So if we retreat and we do gatherings at home, those people leave that gathering and they go out to a grocery store. And I've even heard of grocery stores having their employees get sick and even restricting hours and how many people can be in their stores even further than the governor. So I really think the message that we want to get out there is that every single person has it within their control to help us get a hold of this pandemic, and including the impact on our businesses, large and small. If they're going to a casino, the activities that they engage in there. If they're going to a shopping, how they handle themselves. They have a tremendous effect on the health and future of our economy. So we are begging people to be careful at home and in their private gatherings.
Thank you.
Good stuff. Do we have any other media questions? One last go for anybody?
One thing I want to stress is that I think a lot of people feel helpless, and you need to realize that you are not helpless. You can actually help all of us and help our economy and help our students and help our small businesses and help your entire community by modifying your behavior. You are not helpless. And so, because I think in some ways, we sort of feel like, oh, what can I do? And, we feel like we're failing, but you're not. You can help us get through this. And I think that that's a really important message. And another thing that I'll say, and I might have said it earlier, but this is really important. There are a lot of people walking around right now that think that they just have a common cold. And it wasn't until someone called them and said, hey, I tested positive, go get checked. So I know 3 people from last week that have been showing up at work, been running around, taking their kids places, things like that, thinking they have the common cold. And I think a lot of that happens because people think, oh, with COVID, I'm going to feel so much worse, right? They really thought that, hey, if I have COVID, I'm going to feel way worse. And it's different for everybody. And I think Dr. Nielsen stressed that last night. It really is different for everyone. We don't know why we might see someone, in their 80s that also has breathing issues and comorbidities might be just fine. And then you have a 40-year-old woman that we heard about last night, and she had no comorbidities, and she died from it. So I think in some ways this is so mysterious on a lot of different levels, but just because you have a sore throat and that you're you sort of mimic a cold, just remember that means that it could be COVID. You don't know.
For Dr. Nielsen, just really quick, shouldn't the common cold and the flu be much rarer now too? Because everyone's doing all these other protocols. Is it pretty unlikely that you should be getting everything if you're anything, even a common cold, if you're doing things properly?
Yeah, I mean, time will tell in regards to that question. In the Southern Hemisphere, last, what was their winter during the summer, they did see lower flu numbers, probably due to, the same measures we're doing to mitigate COVID, which is like hand washing, mask wearing, distancing. So, I mean, it'll be interesting to see if several months ago, everybody was talking about the double whammy of influenza and COVID kind of hitting at the same time in late fall and through the winter. We don't know if that's going to be the case. We are seeing a small amount of flu. We haven't seen a significant amount, which is good. But I mean, I presume that we will hopefully see less influenza and general cough and colds this year. But that's all. I mean, that's contingent upon everybody doing the things we need to do for COVID anyway. So,
because the cold and the flu you catch the same way you would catch COVID, right? Or both of those pretty much
generally.
the same? Generally,
they think COVID is probably a little more airborne. Months ago they thought it was more just droplet, which is, we can go into the details of it, but it's kind of complicated. But they think COVID is more truly airborne. At least that's what the data is showing.
So if you're sick, you're more likely to have COVID than a cold, because cold or the flu are harder to catch a little bit. So if you're sick, it's easier to catch COVID than it is the common cold, right?
Yeah, I would say it's more infectious. We know that for sure.
Okay.
All right, folks. Well, thank you so much for your time, and especially to all the frontline folks. This continues to take a toll, and it's real. So I appreciate your time on this and your work for it. We'll have this recording available if anybody else wasn't able to get it, or there were any technical glitches on your end. Just shoot Matt or I an email, and we'll pass it along.